Hey, Dr. John here. Hope you enjoyed my channel and the different aspects of the videos, but today we're going to go over a little bit of an educational video. If you've noticed, I've got a little bit of longer hairstyle. Just haven't had a haircut since March. Maybe some of y'all are the same situation. The one thing that I see the most, and if you ask me, Dr. John, what is the one thing that most people come in with? It's heel pain. There are millions of patients all the time, all over the world, that have heel pain. And the one thing that they could end up doing at home may be able to solve it, at least if you catch it early, and that's stretching. So there is a quick 3-minute stretch that I'm going to go over with you. Now you may ask, Dr. John, what about this other stretch, or this? My physical therapist told me to use a band and a lot of different things. They all work. Stretching boards, slant boards, these wonderful devices that you can step on and roll on, the TheraBands when you start to pull on to the heel and just give that stretch. All of these work. Even physical therapy. I have a lot of patients that I actually will send to physical therapy. But what do we do if it's just a quick, stretch that we need to hurry up and get done in our slant boards at home? We don't have a TheraBand, and there's really no steps to step off of. This is the 3-minute stretch.
So as I mentioned before, there's slant boards, there's TheraBands. A lot of times these are used for plantar fasciitis, for Achilles tendonitis, all great methods. There's a Pro Stretch device that you'll see. So these are all wonderful methods to stretch, but what my focus is, how can we just narrow it down to something simple? Keep it simple. And that's the whole purpose behind a 3-minute stretch.
Hey, Ian. All right, we're going to demonstrate a couple of our stretches here. The first stretch, what I want you to do is come against a countertop or a table or a sink or your dresser. You're going to kind of lean up against that. As you bring your foot that you want to stretch, you're going to bring it slightly back. You're going to bend both knees. And you're going to keep that heel planted on the ground. Don't raise up the heel, okay? And when you do this stretch, you should feel it right at the back of the heel, right along that soleus muscle and the Achilles tendon attachment, right there. You want to hold that stretch for 30 seconds. 30 seconds has been shown to be of the most benefit. And once we've done that stretch, then you want to switch it to the other foot and do the same thing, 30 seconds, and then that's 1 minute. All right, now we're going to do the good old runner stretch. So you want to come against the wall, and you're going to bring your foot further back. This time you want to keep that knee locked and straight. That's got to be straight, cannot be bent. If you bend it, you will lose the stretch. Your heel is planted on the ground. Don't raise it up. And then you're going to lean into the wall, at the same time driving that heel into the ground. And as you lean into the wall, you'll feel it in your calf muscle. You should feel it right in the back of the calf muscle. Hold that for 30 seconds. Switch. Other foot, basically same thing, 30 seconds. And you can just hold it for that 30 seconds, and that's 2 minutes, and you're done. All right, the last stretch for this 3-minute stretch is we're gonna sit just like this. You're gonna bring your foot up, pull up on the toes, and you're really gonna be pulling up on the toes at the same time pulling up on the ankle, and you'll feel it right into that arch area, right in the plantar fascia. We're not trying to really stretch this out too much. Shouldn't be too painful, but basically we want to be able to stretch it for 30 seconds, switch to the other foot, 30 seconds. You can leave your sock on or sock off, but you definitely want to pull up on the toes and make sure that you're really pulling up on the toes to get that full stretch.
So I hope that 3-minute stretch gives you at least something to start with on your road to heel pain recovery. Remember, it's not all-inclusive, and there are a lot more stretches that you can incorporate. But if you want to be quick, simple, and have a exercise regimen or stretching regimen that you will keep to and do every morning and every evening, this is it. Now, for my patients who still have heel pain, there's a lot of other ways that we can look at stretching, including night splints. So if you want to find out about the next level of stretch, look for my night splint video and we'll discuss it in depth. Until then, hope you like this video. Subscribe. Tell me what you want to hear in the comments below, and we'll see you next time.